Hello everyone, I am Dr. Ankita Chauhan, consultant gynecologist and laparoscopic surgeon in KIMS Cuddles, Kondapur. So today we are going to discuss about endometriosis. So let's first understand what is endometriosis. So this is one normal uterus. Uterus has three lining. The innermost lining of the uterus is known as endometrium. So whenever this endometrium is present outside the uterus, then that condition is known as endometriosis. Depending on the position of that extra endometrium, the types of endometriosis will vary. This endometrium can be present on ovary, tubes, or other pelvic organs like bladder in front of the uterus or rectum behind the uterus. In rare cases, endometrium have been found in organs like lungs, brain, esophagus, nose, etc. So, let's discuss how a patient will come with some symptoms of endometriosis. The most common symptom of endometriosis is pain. That pain can be during her normal periods, otherwise in between the periods, during urination, during defecation, or even during intercourse. One more very common symptom of endometriosis is infertility. Okay, now let's understand what actually happens. So when this endometrium is present around the uterus, outside the uterus, and during normal menstrual cycle, whenever the endometrium inside the uterus is bleeding, the endometrium outside the uterus will also bleed, resulting into blood collection outside. It could be ovary or the tubes or wherever it is present. So once the bleeding stops, this blood collection will lead to scarring, and scarring will lead to adhesions and lot of inflammation in between the organs. So this is the main problem which leads to all these symptoms. Now, how endometriosis is diagnosed? Diagnosis of endometrium is very difficult because it cannot be seen in the ultrasound. The only condition which we can see in the ultrasound could be ovarian endometriosis in the form of cyst. Whenever a lot of blood gets collected into the ovary, we can see it as a cyst with some chocolate colored fluid into that, which is known as chocolate cyst. So that is one. The gold standard, that is the ultimate or ideal test to diagnose endometriosis, is laparoscopy surgery. Now, what would be the treatment for this? The treatment would be either medical or surgical. Medical treatment, patients do not respond to medical treatment very well, and it could be only temporary. Surgical treatment will depend on the symptoms of the patient. For example, if somebody has ovarian cyst, then the surgery has to be performed to remove that cyst. If there are adhesions behind the uterus along with the rectum or along with the bladder, the adhesions between the bladder and the uterus, then the surgery has to be done to remove those adhesions, and so that patient can have relief in the symptoms. So the surgical treatment will vary depending on the symptom. If the patient has ovarian cyst, then the treatment would be excision of that cyst. If the symptoms are because of any adhesions, then we have to go and release the adhesions. Many times this endometriosis is just an incidental finding during performing laparoscopy surgery for some other condition. In those conditions, we can see small patches of endometrium around, on the uterus or the peritoneum around the uterus, on the bladder or other pelvic organs. This could be some incidental findings. Like we have already spoken about the treatment, but always remember prevention is better than cure. So there are certain dietary modifications or the lifestyle modifications which we can do to avoid or to keep this endometriosis under control. So it is seen that endometriosis is very common in females who eat a lot of junk food, lot of caffeine or processed food or animal based diet. So there have been a recent study which shows that decreasing the amount of animal products in our diet can improve endometriosis up to a certain limit. So these are certain lifestyle modifications. We have to avoid caffeine, we have to avoid processed food, we have to avoid junk food and all animal based products, which include red meat, even dairy products. Simple carbohydrates like sugar will also increase the chances of endometriosis or the severity of endometriosis, as they are going to increase the inflammation around all these endometriotic patches. So simple changes in our lifestyle can relieve us from this very severe condition known as endometriosis.